how to perform hand hygiene, then explain I will be next assessing the cardiovascular and peripheral systems of the body. I would begin by asking the patient if they've had any recent chest pain, any palpitations, and for survey, like a general questions I would ask about their present health status, if they've had any chronic illnesses such as diabetes, mellitus, renal failure, chronic hypoxia, hypertension, if they're taking any medications, if they've had any side effects, what over-the-counter drugs they took, do they take aspirin on a regular basis, do they take herbal medications. In terms of family health status, I would ask if there's anyone in their family with a history of diabetes, mellitus, renal failure, chronic hypoxia, or hypertension. If so, who? Patient responded no to all these questions so far. And for personal and psychosocial history, I would ask if they've ever used cocaine or any other street drugs, how often they would use the drugs, if they exercise, and how often, what kind of exercise. I would ask them to describe their personality type, how they deal with stress, or what are their immediate stressors, how often do they take time to relax. In terms of personal, also I would ask to describe their eating habits, how often they eat red meat, do they monitor their fat and salt intakes, do they eat whole grains each day, do they drink alcoholic beverage, if so, how much and what kind, do they consume caffeine, do they smoke, or have they been a smoker in the past. My patient did say they do consume coffee every morning. And is not a smoker. Past medical history would ask if they ever had childhood growing pains unexplained, any heart murmurs, have they ever been told if they were having high levels of cholesterol or triglycerides, if they've ever had heart surgery or on their blood vessels, and things like that. I would then inspect if there was any visible palpitations, any thumping of the arteries. I would assess their skin characteristics, like their skin turgor, but the patient does not appear to be dehydrated. The skin pinches right back. And then I would auscultate by putting this. I'm going to do what I did sort of for the other part. I put these in, but for the purpose of this video, I can't hear. But I would have these in, and then I would auscultate. Let me grab my pillow. And it would be like I was looking at the patient. I would begin at the second intercostal area, the aortic, and I would listen. And then I would move over to the second on the other side, and I would listen at the pulmonary. And I'd probably listen to each of these for 30 seconds. Then I would move down just slightly to the third intercostal to hear the Erb's point. Then I would move to the tricuspid, the fourth intercostal, then the mitral, the fifth intercostal, and then right around the fifth intercostal, I measure the PMI, the apical pulse, for about a minute. In terms of video, I'm not going to wait a minute. Then I would ask the patient if there was any numbness or tingling anywhere, if they were experiencing any pain. I would inspect their skin again, their hair distribution, if it was full, if there was any infestations, if it is a good color. I would also assess the capillary refill in both sides of their, bilaterally in their hands and their feet. And it should be less than 2 seconds, which it is. And I would do it on the foot as well. Nail shape, there's no clubbing, normal, just a slight curve like it should be. That's good. And then I would also palpate the peripheral pulses bilaterally, the radial, brachial, and the posterior tibial, which is like, you can see like back here. And I would also do the dorsalis pedalis, which is on the top of your foot. And when I was down there, that's where I would assess the capillary refill as well. I would also just look around if there was any edema, if the skin was swollen anywhere, which there's not. So that's good. It appears the patient is cardiovascular health is intact. And then I would thank the patient. I would lower the bed, put the collar back, perform hand hygiene, and document my findings.